I'm Dr. Zoya Diwan, and today I'm going to be talking to you about the chronic overfilled face. What we're seeing is that filler is lasting longer than we thought. Patient is that you can become quite size blind. Practitioners that are not very experienced and are just in it to sell, naturally enhanced and rejuvenated. And that's what we do here. Hi, I'm Dr. Zoya Diwan, and today I'm going to be talking to you about the newest trend, which is moving away from that overfilled, too much filler in your face to that more natural look aesthetics. This has been championed by many celebrities, including Kylie Jenner, Molly May, Huda Kattan, Courtney Cox, Chloe Sims, and many, many more. So why might you want to have your filler dissolved? I mean, who is that even recommended for? So classically, it's for anyone who has had their filler go wrong or has had some sort of complication. But we're not talking about that. What we're going to talk about today is that chronic overfilled face. And why do people get this? This can happen for so many reasons. One of the reasons is that your practitioner is putting more and more and more into your face. And what can happen as a patient is that you can become quite size blind. You can become quite fixated on small areas of your face and just focusing on that rather than the whole face as a whole. So when that happens, you start filling up more and more and more into certain areas of the face, making the proportions and the sort of overall effect and look of your face completely off. Also, a lot of people get upsold dermal fillers when it's actually not in their best interest. And this is done by practitioners that are not very experienced and are just in it to sell. Another reason is that practitioners aren't assessing their patients properly. If you take a good and thorough assessment of your patient, especially a patient that has previously had filler either with yourself or somewhere else, you will find that actually what we're seeing is that filler is lasting longer than we thought. So it's important to check that you're not overfilling that face because there's already some filler left in there. People are also getting absolutely fed up of these, millions and millions of filters to make you look a type of way, these sort of ridiculous standards of beauty that are out there, of all these photoshopped and edited photos and videos. And I think people are just absolutely fed up of it and just want to really, really sort of embrace their own natural beauty. So if you do have to have your filler dissolved, what should you expect on the day? So the main risk with dissolving filler is for you to have an allergy to the actual product, which is called hyaluronidase, or Hyalase for short. So Hyalase can give you an allergic reaction. It's very, very, very rare, but it's important that your practitioner or the doctor does a patch test for you. So this will just ensure that you're not allergic. So that's the first part. The next step is, depending on the area that you're having dissolved, to say, for example, if it was your lips, that's an area that we see a lot of, unfortunately. So if it was your lips, for example, you'll get numbing cream on there, and then that will be on for about 10 minutes. And then the Hyalase is injected into certain areas around the lip, depending on where the filler was injected. And then that doesn't hurt very much at all. I've never ever had anyone that says, really stung or anything. If anything, people think it's going to hurt a lot. It actually doesn't really hurt. And it's over very, very quickly, less than a minute. Then what we do is we really massage it so that Hyalase is really getting into that filler and it just dissolves it away. So it actually works quite quickly within the first 4 hours, but because of the injecting itself, you can have some swelling. So the full result takes a good sort of 14 days to get. So then if you, after that, want to get the area refilled in a more natural way with less filler, or in a technique that's better and looks more natural by a better practitioner, for example, then what you need to do is wait at least 2 weeks. If you can wait a bit longer, like 3-4 weeks, then that's probably even better, but 2 weeks is the minimum time. A lot of people come to see me where they've been elsewhere and they've been overfilled and they want it dissolved. So then when I dissolve it and then they want to be refilled, the common question that they ask is, will it just look like it did before? And the answer to that is no. Firstly, because previously it's probably been placed in the wrong anatomical location. The wrong product has probably been used. Fillers come in all shapes and sizes. And trust me when I say, the quality of filler is staggeringly different across the board. And you want to use a very high quality filler. We have a whole video on that if you want to see that. So right place, right product, right amount. It's not about putting tons and tons in one place. It's about putting small strategic amounts in strategic places to make it all look nice and natural. You want to go to someone that's got a lot of experience as well, and you want to go somewhere that is going to look after you and not just have their own interests at heart. So there's a difference when you go somewhere to get filler done to just dramatically change somewhere on your face versus when you go somewhere to get something naturally enhanced and rejuvenated. And that's what we do here. And also, it's not always about adding more filler in. There might be other treatment strategies that might be better suited to what you're trying to achieve. So there's actually lots and lots of different options out there other than fillers that can sometimes address your concerns. Not always. Fillers are an excellent option if done correctly, and is one of my favorite treatments to do. But there are so many other options, and it's important that your practitioner discusses all of these with you so you can make an informed decision. So thank you for listening. If you have any questions, drop a comment below, and we'll see you soon.